This is Steve Parker of Elite Therapy Solutions in Richardson, Texas. Today we're going to go over tension headaches and how to get rid of them. If I couldn't get rid of tension headaches, I guarantee I wouldn't be married today. Okay, first of all, we have to figure out where tension headaches come from and where they end up. If you turn around here and move the camera over, here we go. Now let's identify some structures here. You got the the trapezius muscle, big muscle. You got the levator scapulae. You got your paraspinals up here, coming up here. You got the base of the occipital lobe of the skull. And what happens is these muscles all attach right here, and they pull on the fascia that goes over the top of your head. And you'll find that tension headaches, usually it's dominant side. The tension headache will start right here and go around to the front here, and the same way on the other side. But it's usually the dominant side where you get the worst headaches. Now we're going to use some methods today that use acupressure from studied under a shiatsu master for a while in Delray Beach, Florida, and we've identified some areas you can hit with your. And I like to use my thumb because it's the strongest. My thumb's arthritic at my age, but this is the scapula or your shoulder blade, and we go down this edge of the shoulder blade, and we hit these hot spots, and we go down, all the way down, and you hit it, and you hold it for a couple of seconds, and they'll kind of moan a little bit because it hurts, and you move on to the next spot, and you hit that, a couple of seconds, hold it, and you work your way down to the end of the scapula. At that point, you hit the levator scapulae, which is the place that, if you ever watch Star Trek, is where Spock would grab the person and they would pass out. And by doing that, that relieves the stress on the muscle and it relaxes as well. Something else you can do, and you're going to do this on both sides. But another way to release the trap is to actually grab it and lift it like this, and he's in pain right now, and this is normal. And then you relax. After you've done this, and you've done up the trap, then you catch the edge of the neck, the side here. You grab it here. You bend the head to the side, and hit the muscle on the side. Hit it here, and you relax that. Now you can, if you want to be. Well, we can do something else by going up the back of the skull and go all the way across the top and turn around real quick. And you come across the top and you stop here and then you go around the side, just giving pressure on the fascia around the head. And you hold for a couple seconds and move on. So you've gone over the top and around the side. And come back around. And the next thing we're going to do is you identify the base of the skull. And you feel the skull here. You identify some points here. There's usually one right there. I've got it. Mm-hmm. Yeah, he'll tell you if you get it. And there's one over here, but it's not as pronounced. Over here, it's right there. It's pretty pronounced. Over here, not so much. And this tells me he's right-handed. He's lifting this arm all the time, and it's going to put more pressure on the right side. Okay, the next thing we're going to do the occipital release. And Morgan's here with Matt, and Morgan is cupping her fingers like this at the base of his skull, and you can feel the occipital lobe on the ends of your fingers. And she's going to sit there and hold it. And with most people, you hold it for at least 2 minutes because we know that stretches connective tissue. But you may want to hold it longer. I usually hold it till I start cramping, and then I'll let go. And at the end you're pulling. At the end, you're just pulling just a little bit of traction on the neck. But you start out just sitting there, hold it. And if you don't have a table like this at home, you can get on the floor, and you'd lay on the floor and put your hands up underneath their head while they're laying on the floor as well. And at the end of it, when you start cramping, you'll just pull a little bit on the fascia. Just give a little bit of traction. And at the end, what we're going to do, we're going to have the head, and it's funny because the people will think you're going to drop their head even though you're about maybe a fourth of an inch from the table. They always fight and tense up when you start moving your hands away. Just tell them to relax. And at that point, you're going to go to each side, the base of the occipital lobe, and find those hot spots again and massage it. So let go now. Pull your hands out from underneath. And now go to the side and massage it to where the hot spots are with your fingers. And they'll usually talk to you because there you go. And they'll tell you when you find them. Matt's hot spots aren't that hot right today, but usually if somebody has a bad tension headache, you'll find little knots at the base of the occipital lobe, and it'll be easy to find them. And then after you do that, I like to put some pressure on the top of the traps with your fist. So take your fist and do the top of the traps and try to give them a little more release, and you can massage it a little bit, and then we're going to move him back to the sitting position and do the upper trap massage. Now Morgan's going to work a little upper trap on Matt. Going to hit her with some massage. Go ahead. Okay, goes down to the edge of the scapula, shoulder blade, and then works her way back up, and gets on top of the scapula and hits the traps. There you go. And this is a way of finishing up the occipital release.